So we're honored to present our first speaker of the night, Dr. Tom McPartland. He's a pediatric orthopedic surgeon who graciously donates his time as a member of the volunteer clinical faculty at Robert Wood Johnson Medical School to enhance the education of medical students. He graduated from our school in 2001 and stayed here to do his orthopedic surgery residency. Following his residency, he did a fellowship in pediatric orthopedic surgery at Harvard Medical School and worked extensively at Boston Children's Hospital. He's a recipient of the 2006 Arnold P. Gold Award in Teaching and Humanism in Medicine, as well as the Compassionate Doctor Recognition Award. Please give a warm welcome to Dr. Tom McPartland.
Thank you, Stephanie and Andrew. Is the microphone on? Sounds like very good. I usually don't hang out at the podium. I'm going to walk around a lot. I grew up with a preacher who liked to walk up and down the aisles, make sure everybody wasn't sleeping, so I'm going to do the same. I love this concept. I was really excited when that came from. I thought I might have a little bit of useful advice to share with you about where you're sitting now, where you'll be in 5 years, 10 years, 15 years, and 20 years, and how that's going to change. And just like Dr. Taragino said, education is something that's very important to me, okay? And I think it's important to understand how you, who may have educated in tutoring in college, you may have TA'd in college, if you have a grad school background, you spent some time, how are you going to become an instructor? How are you going to teach people how to be doctors? Because you're just learning all of that right now, and this is new knowledge that you're acquiring, and it's overwhelming at times, okay? A couple of you are like, I've got to study for an exam later on tonight. I've got a few minutes tonight to talk about some bigger things, okay? Educating doctors is a complicated thing, okay? Teaching doctors how to use a pointer is a complicated thing, too. At the white coat ceremony, we all read these words in some form, okay? Embedded in the text of the Hippocratic Oath is the obligation to impart this knowledge to others. Now, at this point, the MS1s probably don't feel like they have enough knowledge to share with people, but believe it or not, you really do. Probably learned 10,000 new words this year. The MS2s are about to take part one of the boards. They know more about physiology than any other attending physician, or at least they will in 2 months right before they take their exam. The MS3s have already been in the clinics and they're seeing patients. They know how to mentor the first years and second years. I remember having a third-year student mentor me at St. John's Clinic here in New Brunswick and thinking, wow, I'm absolutely amazed by what this person who's been in medical school for 2 years is capable of. And so what I always kind of focused on was this idea of emulation, this mentoring process, okay? And you may feel like you're on one side of it right now, but you'll very soon find yourself on the other side of it. I'm sure you MS1s already have people calling you up, hey, I hurt my wrist, what do I do about it, right? Everybody's had that call. So how do we impart this knowledge to those who wish to learn it? Very important thing. You have to impart it in the right way. And I think emulation is a good model to describe that. What is emulation? Emulation is to look at a behavior, a whole complex series of events or actions, and to try to model yourself after them. And to do that and incorporate that into your own persona is not an easy thing. And it's a very slow, evolving process. And you may sit there and ask yourself, how am I going to do that? How am I going to do what Dr. Sowitz can do, okay? How am I going to be able to talk to patients as well as he does? Believe it or not, he doesn't even know it, but he was an inspiration to me when I was a first-year medical student because he helped my classmate, still one of my best friends. Her stepfather was dealing with stage 4 lung CA. And I just remember how she came on every day. I can't believe how wonderful Dr. Sowitz is sitting and holding, talking to him and just being very supportive. And I said, I understand how that's a part of your persona, but how do you do it? Well, you do it by learning, by living it, by doing it. And you're not going to learn it the first time you do it. And you will learn some key phrases and a couple of different body language things that you can do. But this is very nuanced type of stuff. And it takes time to acquire that and time to integrate that. And the way one person does is not going to be exactly the way you do because your temperament's different. Your patience is different. We'll talk about that in a little bit. But you really have to be able to incorporate all these things that you see and emulate what do you think are the best practices, the best models into yourself and make it comfortable and fit how you want to be a doctor, okay? You're already on your way there. You don't have that MD behind your name yet, but you're already doctor. Okay? The oath is powerful. Don't forget it. Keep a copy of it with you all the time. Put it on your bulletin board, put it on your iPhone, have a PDF, put it in your schedule 3 months from now that it just pops up as a message to you somehow, and read it well. Remind yourself all the time why you're here. I like to think of learning as a layered approach, okay? I like the onion model, all right? I always think of ogre and donkey having that conversation. Ogres are like onions, right? We have layers. The point is that you add more and more layers to everything, all right? You are not going to learn it all right now, okay? And I'm sure if you ask someone who's been in practice in medicine for 35 years, they have not learned it all, okay? First of all, the rate of medical knowledge expansion is growing at a rate that some people have even suggested that we should be super specialized because we can't possibly keep up with everything. And I think you'll lose a very important element of being that person's doctor, especially in primary care, and being able to be involved in all aspects of care. You don't want to pass it off. You don't want to just kind of triage things down the line. You really want to be able to care for the whole patient. So you have to continue to acquire knowledge. You have to integrate that knowledge into what you already know and build your understanding. Make sure you get it. Make sure you're not integrating it the wrong way, because that can spell trouble for people. You have to question and expand the knowledge, seek out answers, be an active, proactive adult learner, and then repeat. There was always this Friends episode where Phoebe is, Friends, you guys know Friends, right? Okay, good. So Phoebe was singing a song about shampooing her hair and reading the shampoo bottle, and it was lather, rinse, repeat, lather, rinse, repeat, lather, rinse, repeat, as needed. So you want to repeat this process time and time and time again. Never stop learning, and you'll add layers to your onion. Learning doctoring is even more complex than acquiring knowledge. So the MS1s and 2s, a lot of classroom time. College plus, right? That's what I always called med school. Everyone laughed at me, but in a lot of ways you're still doing a lot of classroom learning. But the best part of your week is when you get in PCM and you get out and get to actually see patients and see what it's like to be in that environment, to see how someone is caring for somebody else, to start to emulate that behavior and integrate that into your own persona. Learning doctoring is a lot more complicated than adding that knowledge in the classroom. Not only in this patient encounter do you have to rapidly acquire and synthesize information, formulate a treatment plan, you have to educate the patient, maintain a high standard of ethics and professionalism, and above all, communicate with people well, and do all this while still being very nice, okay? And unfortunately, the time that we have to do this constantly gets pressures from the outside to contract and contract and contract. PCM is great. You go and take an H&P, you take an hour to take an H&P. It's the greatest thing in the world, okay? So you really get to talk to somebody and feel like you know them when you walk out of that room. But the practical reality is that I may not get to know somebody completely the first time I get to see them. If I see them 6 times over the course of 5 years, I'll know a lot about them, but in that first encounter, I may not. And you have to accept certain limitations that you have and not get frustrated and still be nice. So as a learner, how do you go out and try to acquire all this? And you have to be proactive. You have to look for inspiration. What fires you up? What gets you up in the morning? I love this idea that each one of you has a different reason why you're sitting here. And it's not one reason, but if you get drilled down to the kernel of truth that brought you here to medical school, you know why you're here, okay? And you may not talk about it to everybody, but you know why you're here. That is something that will constantly be challenged. And that will change. What motivates you, what gets you out of bed in the morning, what gets you to work, what makes you take care of people will change as your career evolves. It certainly has for me. It certainly has for me. And I will tell you the most important thing that ever happened to me in being a doctor was to have kids. I take care of children with orthopedic problems. And I became far more empathetic to the mom with the screaming baby. I changed the diapers of the kids laying on the table because I get it. Your perspective changes as you go along. As you integrate real-world knowledge from the outside, you're going to change. And why you're doing this is going to change. So what you feel right now, that will change. Don't be scared of that. Accept that and embrace it as you move forward. Most important thing, okay? Some of you, we're all adults. We've grown. We've had different life experiences. We draw from different strengths. We recognize our weaknesses, and we work on improving those. Be true to yourself. Recognize what you can and can't do. I'm not saying don't challenge yourself. I think Ralph Waldo Emerson said that I want to get this right. The challenges in life make it interesting. Living up to those challenges is what makes life worth living. So you really want to make sure that you challenge yourself and let your personality shine through. When I was kind of putting this talk together, I had a lot of thoughts, and I liked the idea that it wasn't on paper, so I could just kind of roam around and talk for a while. But the whole idea of letting your personality shine through, you're not going to be able to do that in medical school as much as you want to. You're not going to be able to do that as a resident as much as you want to, even the first few years of practice, because you're so stuck on the analytical and synthetic part of the encounter, trying to get to the right diagnosis and formulate the right treatment plan, that you kind of lose the chit-chat and the kidding around and the humor. Don't worry, that will come. It's okay to let that go. Give yourself a little bit extra time when you can to talk about and do those things. But let your personality shine through. When you're an educator, do the same things. Be proactive. Look for inspiration. Be true to yourself and let your personality shine through. And don't forget it. I wanted to give you a couple guidelines to be proactive. How are we doing on time? Because I could talk for hours. I do usually. Anybody who's been in my office knows that too. Education is the ability to listen to anyone without losing one's temper or self-confidence. So listen to them. They have a problem. They came to you with a problem. Even if it's the most inane thing, don't be annoyed about it. And if someone's telling you something that you're like, wow, they know a lot more than I do, don't lose confidence. You know, you're adding layers. Be confident in what you know. Continue to expand your knowledge. I thought this was really cool. I found the Chinese symbol for the verb to listen. If anybody is familiar with the Mandarin language and understands the symbols, tell me if I'm wrong in putting this up here. But the symbol for listening is actually an ear, a head, eyes, and a heart. Pretty interesting stuff for a language that was developed 4,000 years ago. Listening is the most important thing that we do. Everything else is secondary, because without really engaging the patient, without really engaging your student, and we start talking about education, we're talking about teaching people too, teaching students, we're teaching other doctors. You really want to listen. And when you look at people you want to emulate, you want to see people who listen. And watch how they listen. Watch how they posture their body. Watch how they're trying to walk out the door as they're talking to people. You'll see bad behaviors too. Make sure you don't do those. Be patient. Don't watch the grass grow, but be patient. Patience is the hardest thing for us to do. It's the easiest thing to let go of. Don't let go of it. Everybody has their different length of their fuse. Make your fuse longer. Look to your mentors as a model for emulation. I love this picture. I didn't have one of my son doing this, but you will integrate different things that you see in different people you come across in your life. And you will identify mentors, people who really stand out to you as people you want to emulate. Sometimes you may even feel, and I want to give you guys just a little bit of advice, you may feel like that's pulling you toward that field that person's in. Just because the person you want to model your practice after is in a field that you think, oh, maybe I'm interested in that, doesn't mean that's the field for you. It's okay to be like that person, but not be in the field that they're in. And that was really good advice someone gave to me long ago. So you want to look for your mentors. Oh, then put yourself in your student's place. So we're talking a lot to you, I'm talking to you like you're learners right now, but as you're becoming more involved in teaching the people below you, and people are starting to emulate you, put yourself in their shoes. So when you're a resident and you have a third-year medical student on July 1st following you around asking you about stuff, and you've been up all night, remember where you were sitting here today and first day of medical school so bright-eyed and excited about this, okay? Don't let that excitement fade. Keep that kernel of whatever it is that brought you here. Keep it strong. Keep it burning bright. Accept criticism and feedback. This is hard, okay? This is hard because you know what? You're all superstars. You've all done great things in life. That's part of the reason that you're here, but it's not the only reason that you're here. It is incumbent on the people who teach you, and then incumbent on you to the people you teach to criticize you. Because there are things, when you're trying to emulate behavior, you're going to emulate bad behavior, okay? I hate to say it, but I've done it. You'll do it. We've all done it, okay? It is important to accept that you will make mistakes and that you will fail. It does happen. It will happen. It absolutely happens on a daily basis. However, if you don't learn from that failure, that's the biggest mistake, right? So accept criticism, accept feedback, and move forward. Accept that your style will change as your career goes on. We talked about the reason that you're here, that reason you know deep down inside. But your personality, how you conduct yourself is going to change a little bit. And that's maturation. That's adding years. That's adding life experiences. Don't be afraid of that. Embrace that. Incorporate that. Find the strength in it. Recognize the weaknesses in it and grow. Always remember the golden rule. Major religions around the world, they all have their own different version of it, okay? What's the golden rule? Do unto others as you would have others do unto you, right? Never forget that. Whether we talked about walking in somebody else's shoes, remembering what the student was like sitting here, thinking about the patient who waited an hour in your waiting room and they're frustrated. Of course they're frustrated. Take a step back, take a deep breath, and then proceed. That goes back to patience. That goes back to listen. It goes back to everything. If you want someone to listen to you, you will listen to them. Think about when you go to see a doctor, okay? That encounter is very different for you now than it was 10 years ago when you didn't have this knowledge. So your questions are a little bit faster and very much more pointed and focused now than they were before, but they're probably even more eager for the answers. And if you're not getting them, you're not going to be satisfied. So take that time to answer the questions. Make sure you get through everything you need to get through. The most important thing is to find your inspiration. And I think that changes a lot. This changes everything, believe it or not. These are my two kids, Gavin and Emma. And it used to take me a long time to kind of finish my work at the end of the day and get through everything. Now it's done, so I can get home to these guys, all right? That becomes a part of that life experience. This is the middle of my onion. And my wife, Joy. The kids got depressed, though, unfortunately. I'm not a stand-up comedian. I'm not a musician. I love the idea of incorporating art and everything. But I think if you think about these concepts of emulation, if you think about what really pulls it together for you and be accepting of the changes that will come ahead of you, look for people who you identify as those that you want to practice like, that you want to behave like. I think you're going to be very satisfied with your careers ahead of you. You have a very bright future, and you're at a wonderful place to learn. Thanks, guys.